All right, today we will be talking about careers in healthcare. So, as always, you should be writing these notes on a piece of paper. You should be handwriting them with your name at the top, title of this lecture. So, this is part one, and then making sure that you're submitting it before the end of the period. Also, keep in mind this lecture you will need to complete a presentation project. So, just please pay attention because I will be addressing common questions that students have when it comes to creating that assignment. All right, so just this is kind of what this class is all about. Maybe this is the reason why you signed up for it, but yeah, I'm basically introducing you to different health careers, and then you have an opportunity to research one that you are interested in, and then you will create a presentation, which I'll explain when we get to it. So there are obviously different levels in healthcare. I'm sure you're familiar with physicians, which you would think would be at the top. And then you have, RNs, which would be below them, and then below them would be medical assistants, that sort of thing. So there's different ways that you can get into a healthcare setting. You do not need to go to school for, 15 years like you might think with a physician. If you want to do that route, then yes, you're going to have to go to school for a while. But you can also work in healthcare and work in a job where you didn't have to spend that much time on your training. So that's kind of where the on-the-job training comes into play. This is where you're probably getting the least amount of education. They might be training you just to do the specific things that are needed for your job. Keep in mind that professions like this oftentimes are not going to pay as high as ones where you're actually getting a college degree and that sort of thing. You can also do a HSTE program. So this is a health science technology education. This is what ROP offers. So if you plan on doing ROP's medical assisting program or dental assisting program, what else? Certified nursing assistant. Those are all parts of health science technology education. So those programs are things like with, let's say, your CNA program. They are going to be going to classes at night for 6 months, and then you basically sit for your test, and then you're now hired. So that's another shorter amount of time, but you can still have, obviously, a job in healthcare. You have your associate's degree. So this is a degree that's coming from a 2-year college. You can be a registered nurse without getting your bachelor's degree. So they do have community college programs, which, again, lower level of education. However, the pay is not too terrible with someone who has associate's degree. You might make more as an RN with your bachelor's degree, but you can still make a decent amount of money with your associates. Your bachelor's degree is going to be above that. So that is typically a 4-year program. That is where if you get your BSN or Bachelor of Science in Nursing, that would be what you get. If you plan on pursuing to be a physician, you would be doing a 4-year degree, probably in something to do with biology. And then you would go to your medical school, which would be another 4 years. And then you would go into your doctoral residency. And then you have your master's degree program. So master's degree is 2 years on top of your bachelor's degree. And then lastly, you have your PhD or your doctoral degree. So this is a little bit different than, a physician. A physician's going to, like I said, have that 4-year bachelor's degree, 4-year med school degree, and then their residency program. But if you plan on doing, let's say, something like physical therapy, that type of program would be 4-year bachelor's. And then on top of that, you would have your 3 years for your PhD program. Depending on the profession, the majority of careers are going to require either certification, registration, or licensure. So certification, and you're going to need to know the difference between the three. Certification is essentially you're passing a boards exam. So a boards exam is a comprehensive test that you take at the end of your schooling. So you need to go to accredited school that has a program, let's say in nursing or physical therapy, and then you're sitting and taking a test. And then if you pass, you would be either certified or you could be registered, depending on what they want to call it. And then your licensure is basically what does a state require on top of those things. So nurses in California are going to have different licensing requirements than nurses that are in, let's say, New York. And vice versa. And so, like I said, the requirements are going to vary state by state. Some states that might not even require licensure. Definitely with nursing they do, but just know, depending on the profession, you might not need that. And then you guys will be able to obtain this information depending on what state. So again, you guys will be researching a career in healthcare. And so you're going to need to figure out, does that career require certification, registration, or licensure, or maybe a couple of them? And then it's going to depend on essentially what state you're choosing. So if you're choosing California, it's going to be different than, like I said, New York. All right, you have different levels of training. And so the levels of training can kind of indicate, again, the amount of schooling you have done. So you have your aides and your assistants. These are going to be lower level professions typically. So thinking like physical therapy aide, certified nursing assistant. Those are still jobs in healthcare, but they're not going to be most likely as high paying. They're kind of good starting points for people, and then you usually build upon that. You can also have what is called a technician. So like ultrasound technician. That is someone who basically does ultrasounds if you're thinking someone is pregnant. That is a trade type of job. So trade schools typically are schools that are geared just specifically for teaching people how to do that profession. You're not doing the general ed requirements that you would typically see at a college, like taking public speaking, English, things like that. Your technologists are therapists. Those are going to be professions, again, a little bit higher above technician. It's going to vary depending on the profession, but typically these are going to be things where you might need your bachelor's degree and then maybe a master's degree or a PhD. And then professional is going to be, your doctor, your physician's assistant, and so forth. All right, so this is something that you will be researching on your, depending on your profession. Continuing education units are things, and this is where students always have this question, but continuing education units are things that allow healthcare workers to maintain their certification or license. So it's going to vary between careers. They're sometimes called continuing medical education. Just know that they're sometimes used interchangeably, but you will need to know this depending on what your profession is. So I'm going to explain it. And then again, if you have questions about any of this stuff, we can talk about it tomorrow. But continuing education, for me as an athletic trainer, I passed my boards exam, and in order for me to maintain that, and became certified, in order for me to maintain my athletic training certification, every 2 years, I need to submit continuing education units. So I have to submit my CEUs, not this year, but next year by the end of the year. So by December 31st, 2021, I have to show that I have done 50 units of CEUs. And so it's going to vary the number depending on the career. For athletic trainers, it is 50. For nursing, it might be 40. Again, you're going to have to research this, and the years that you have to submit it is going to vary too. But the reason why they have it is so that, one, you're able to maintain your certification, but these courses that you take in order to get your CEUs, or conferences that you attend in order to get these CEUs, are ways that they can basically train you on more current or up-to-date practices. So it keeps you as a healthcare worker up to date with the newest treatments. Like for me, I can go to a conference and maybe get 12 CEUs, and I have sat through workshops. I've learned about new treatment techniques, that sort of thing. So it's really important, but these are things that you will be researching depending on your career. All right, so the first career we will talk about are those that involve dental. So I'm sure you guys are well aware of what a dental career is. It's anything that is involving your teeth or the soft tissues of your mouth. Purpose of these dental careers is to prevent dental disease. So when you go into the dentist, you're getting your teeth cleaned. The purpose of that is not to just cause you to bleed, which I know happens a lot, but it's to make sure that your teeth, your gums, all of that sort of thing are healthy. And then if they are damaged, you would be then either, giving them a filling or replacing them or removing them, depending on what it is. And I'm not sure if you can see this part right here. So I'm going to close out. But treating gingiva, gums, and other supporting structures of the teeth. So gingiva is pertaining to gums. And so purpose of the dental careers is obviously supporting the treatment of these, making sure that your gums also aren't getting infected or diseased as well. Some examples of these careers would be your dentist, your dental hygienist, your dental laboratory technician, and your dental assistant. So the dentist, I'm sure you're aware of what they do, but they are the top person at a dental office. They are the ones that are obviously going through whatever imaging has been done and ensuring that you don't have any type of, cavity, gingivitis, that sort of thing. Your dental hygienist is going to be the person that's doing the cleaning of your teeth. They might be communicating with the dentist about maybe something that they've noticed on your teeth, so forth. Your dental laboratory tech and dental assistants, these are going to be the people that you'll see in a dental office who are performing like the x-rays that you're getting. They might be assisting the dentist during a root canal procedure, handing tools, that sort of thing. So again, these are going to be lower level, and then these are higher ups. And it's also going to be just dependent on the level of education. All right, your emergency medical service jobs. So these jobs are intended to basically give somebody care until they reach the hospital. So this would be lowest level would be first responder. So I have students that I certify in CPR, and these are my sports med students. They are considered first responders if they pass. They don't really have any formal, training. They're typically going to just have taken that course, which would be a CPR course. Sometimes they're only, 4 or 5 hours long, and then they would then pass the test. But again, still important because they can also help someone in a emergency situation. You then have your EMT 1 through EMT 3. So these are the people that you'll see on an ambulance. Sometimes they're also found in hospital settings, but they are a trade job. So they've gone to school for, I believe it's about a year. They have to do a certain number of hours, and then they can apply to become a paramedic. Paramedic is a type of EMT, but it's the highest level that you can achieve. So your paramedic is also going to be someone that you're going to see on an ambulance. Sometimes you will have firefighters when they come to the scene who are also firefighters / paramedics, but they're the ones that are actually administering medication. They are doing a lot of the more difficult and could affect someone's condition type of procedures, whereas your EMTs are just going to be somewhat of an assistant to them while they are treating the patient. Other medical careers that you are probably super familiar with, you have your physicians, which are your doctors. You have your nurses, which we talked briefly about the different levels. And then you have your respiratory therapist would be another example of this. Your let's see, what else would be another good one? Physician's assistant would also be an example of this as well. So these are people who either, if you're a physician, you're going to be the one who is the supervisor. But if you're a nurse, you're going to be working under this physician's supervision. So a nurse cannot do a lot of things unless they have a physician that they are working under, ordering them to do certain things. So that's kind of the purpose of physicians. A lot of times, like a manager, and the nurses are the ones that are actually carrying out the treatment and so forth. That means, though, too, if you choose to be a doctor, you're holding the liability because you're the one that's making the decision that the nurses are going to do. So pretty much the higher up you get, the more liability you're going to take. But yes, so the nurses are working under there. Obviously, with this or any medical career, you're involved in diagnosing different medical conditions. How would you be treating them? Prevention is huge. So how are you preventing these diseases from occurring in the first place, and so forth. So your examples of medical careers, and there are differences in all of these. Again, you're going to need to remember this for your assignment and for the future assignments, but you have your doctor. An MD is who you probably typically think of as a physician. So anytime somebody calls themselves a doctor, you need to pay attention to what their credentials are after their name. So a credential is usually an abbreviation displaying what it is that they are qualified for. So physicians typically will say like John Smith, comma, MD. So that way you know that he is a medical doctor. If they have DO, this is another type of physician. It's just not as widely known, or not widely known, but it's not as widely used in America, at least. You will still have DOs, obviously. They're still physicians. They can still prescribe medication, but they're just a different form of training, a different form of schooling, kind of is the reason why they have different credentials. You have your DPM. So this is also another doctor. They are doctors of the foot. So again, if you're looking at the credentials, they're not only an MD, but they also have this one. And then you also have your doctor of chiropractic. So that is where there's some confusion oftentimes with just general people that don't know this. But chiropractors are not physicians. Yes, they have doctor in their name, but it's not the same as an actual physician. So if someone's name is John Doe, comma, DC after their name, and they're calling themselves a doctor, just know that they're not a doctor in the same way as an MD is. They didn't go to school for as long. A chiropractor typically is only going to school for 3 years on top of their 4-year bachelor degree, whereas your MDs and your DOs are going to school for, again, 4 years on top of your bachelor's degree, and then typically it's going to range from like 3 to 7 years for their actual residency program. So the level of training is much higher. Chiropractors, too, cannot prescribe medication. They cannot like evaluate you for common colds, things like that, like a medical doctor would. They're intended to help you if you have joint pain, things like that. You have physician's assistants. So they work underneath a doctor, but I'm going to try to make it so that you're not confused. But a physician's assistant is someone who, yes, they have assistant in their name, but they're actually able to prescribe medication. Schooling for a physician's assistant is typically 7 years total. So 4 years for your bachelor's, 3 years for your actual PA program. But again, they're working under a doctor, but they're still trained to be able to try to treat and diagnose certain medical conditions and prescribing medication. Whereas your medical assistant, very similar in the name, they are very low level. Not to say anything badly about them, but just know that a medical assistant is someone that is only going to school probably for about a year, 6 months, so way less than a physician's assistant. And they are working oftentimes it's just the person that's taking your blood pressure. They're not allowed to prescribe medication. They can't evaluate medical conditions. They can't treat them either. So they're doing a lot of maybe where the check-in procedures if you're going into a doctor's office or hospital, vital signs, so forth. Last thing we'll talk about today are your therapeutic service careers. So these are careers that are intended to treat people who have either a physical, mental, or emotional disability. And I'm going to say disability. I know you can't see me in quotations, but their purpose is to get people back to the highest capacity for that person. So if somebody is, a psychiatrist, they're dealing with people who have maybe a mental health issue, something along those lines. Not, let's say someone has schizophrenia. Schizophrenia is a, psychological, psychiatric condition. Sometimes people with schizophrenia might not function in society the same way as someone who might not have schizophrenia. But the purpose of these jobs is to get them to function as best as possible, depending, again, on the patient's capacity. So jobs that fall under this, or just, I guess, basic job duties, you have your mental, emotional disorders, so depression, anxiety. You have even autism, I guess, would be an example of this. You have your schizophrenia. You have manic depressive disorder. So there's a lot that fall under this. Social workers, too, can help assist in this area. So if you're interested in social work, you can actually research that as well. That's something that I think most people don't really consider a medical career. But yes, social services, they also are dealing with people who have potential mental illness, drug dependency, that sort of thing as well. And so again, you're trying to get this person to function at their maximum capacity. Doesn't mean that they're going to be functioning at the same level as, the general population, but you're trying your best to get them to where they should be at. And then some examples for these jobs, you are going to have your psychiatrist. So these are people that actually went to medical school and they also completed a residency program. So psychiatrist is the highest level of someone who's working in a mental or social health profession. Try not to get them confused with your psychologist. So your psychiatrist can prescribe medication. They can also diagnose people with certain mental health disorders. Whereas your psychologist, yes, they've gone to school for a decent amount of time. Oftentimes it's a PhD program or maybe a master's program. However, they can't prescribe medication. They're typically the people that you will, talk to. If you have, a behavioral issue. Psychiatrists do that as well, but just no psychologist is below them. You have your psychiatric mental health technician. So these can be people that are seen maybe in psychiatric ward. And they are, again, assisting the psychologist or the psychiatrist with things that they need. Like I mentioned on the last slide, social workers, this is a profession where you wouldn't necessarily think would fall into the mental, or not mental, but medical field. But they do provide a lot of services. They do deal with people that are struggling from certain mental or social issues. And then you have your genetic counselor. So this falls under more social, but these are people who, let's say you're trying to conceive a child, you need to figure out whether or not you have a family history of a certain gene. They're going to test to see if you have that. Or let's say you have a family history of breast cancer. There are ways to detect whether or not you have a certain gene, the BRCA1, I don't know if you've heard, can indicate that you might be more likely to have breast cancer or ovarian cancer. So again, they might test you for that and then explain whatever the results are to you. We will stop there today. So we'll finish the rest of the slides tomorrow. If you have any questions, again, reach out to me. But other than that, we are finished with notes for today. Just make sure you complete them by the end of the period, and I will see you guys tomorrow with the next portion of notes, and then I will explain the rest of the project, that sort of thing, on Friday. But have a good day, and I will see you guys tomorrow.